Hi, and welcome to the Women's Power Network. I'm Woody Lassane, your host. In this show, we bring you topics and interests on issues that relate to women, whether it be in their lives, whether it be in their professional career, or just simply some profiles. Today, I have joining me Dr. Ana Viamonte Ross, who is the Director for Medical Staff Development at Baptist Medical Center, as well as she is an adjunct professor at FIU University. Welcome, Dr. Viamonte.
Thank you so much. It's my pleasure to be here.
Now, today's topic, we're going to be talking about specifically breast cancer awareness. This is a huge issue that impacts so many women. When Dr. Viamonte shares some of the numbers with you, you're going to be flabbergasted. It was staggering for me, and I know that it's going to be something that you're going to be able to understand a little bit better and perhaps take some additional measures to how you can kind of segue and keep that sort of thing out of your life.
Thank you, Woody, very much for this opportunity to speak to you and to our audience also about this very important issue of breast cancer. I think it's extremely important for women to understand the disease, but also to be as informed as possible so that they could be great patients and know especially what to ask their physicians when they go into their offices. But let me put it a little bit in perspective of why this issue is very important. It's estimated that about 240,000 women just this year alone in the United States will be diagnosed with breast cancer. 240,000. So that's very important. And if you break that down, that's about a woman every 3 minutes that's going to be diagnosed. And unfortunately, a woman every 12 minutes that will succumb or die from this disease. So it is a very important issue. The other thing I wanted to mention to you, that of these women that unfortunately die of the disease, over 40,000 women, there is a very small percentage, maybe 400 or 500 of those that are actually men. So you do hear it, it's overwhelmingly a women's issue, but men also should be aware that this is something that they could become afflicted with as well. You'll hear about incidence rates, and you'll see this chart that really recognizes the incidence rates and actually the death rates from breast cancer in the different races and the different ethnic groups. And you'll see that incidence rate really means that within a given group of people, how many actually get the disease. The highest incidence rate is among white women, followed then by African American women and Hispanic women. However, notice in the chart the bar that indicates the death rate. And even though African American women have a lower incidence rate than white women, they have a higher death rate. And that's something that's extremely important. Why is that? Because I think many of these women get diagnosed later in the stage of their disease and thereby have a higher, more difficulty in combating the disease effectively. So it's really very important, especially in our minority communities, to make sure that we inform women that they need to do regular checkups, that they need to do mammograms on a regular basis, to understand their family history as well, and to take care of themselves and not to seek care when it's further down the line, but rather when it's in a very early stage, when it's actually curable and you can have a normal life expectancy.
Well, there you have it. Dr. Viamonte has shared a tremendous amount of information with us, and it's all very valuable. So now it's up to you to do what you will with that. Take that information, not just file it in your head, but actually act upon it. And then go out and share it with your friends and your family and other folks within your life, because we can all certainly have an impact on each other. And in some way, we help to hold each other a little bit accountable in that process. So be healthy, be strong, do all the things that you know that you should do, actually act on it. And we bless you and hope that all will be well.